journey in the years to come. The first one is the Health Sector Strategic Plan 5 from the 2024 to 2025, aimed at strengthening our health system. And the second one is Mission 27, which is Rwanda's accelerated plan to eliminate the cervical cancer as a public health burden. This event comes just days before the World Cancer Day, a deliberate decision to align Mission 27 with the dissemination of the Health Sector Strategic Plan 5, emphasizing our continued commitment to tackle non-communicable diseases. Just as Rwanda's heroes act to shape the country's future, today's efforts to eliminate cervical cancer are about shaping a healthier and more resilient future. Yesterday, we had the opportunity of diving into the Health Sector Strategic Plan 5 pillars with valuable contributions from policymakers, from different development partners, and also the private sector. To quote one of our panelists, Mrs. Bigirimana, she mentioned that these two initiatives are ambitious but achievable. They will require strong collaboration, innovation, and sustainable resource mobilization. To close the day, a QR code was shared that provides access to documents relevant to today's agenda. You will find that QR code at the back of your badges, and this shows that we have started to dive into the digitalization, no more printed copies on your desks. Today, we will dive deeper. Thank you. Today, we will dive deeper into Mission 27, which was adopted from the WHO Global Strategy for Cervical Cancer Elimination from 2020 to 2030. Therefore, it is my pleasure to introduce Dr. Prebo Barango, the cross-cutting expert on NCDs and special initiatives at the World Health Organization. He will present the implementation status of the Global Strategy for Cervical Cancer Elimination 2020-2030. Please join me in welcoming Dr. Barango.
Good afternoon. Happy Heroes Day. Your Excellency, Honorable First Lady of the Republic of Rwanda, Honorable Ministers, Director General of the Rwanda Biomedical Center, all protocols observed. First of all, let me start by bringing you all greetings from the WHO Director General, Dr. Tedros, as well as from the Assistant Director General for the Communicable and Non-Communicable Diseases in WHO headquarters, Dr. Jerome Salomon, and last but not least, the Director for the NCD Department, Dr. Guy Fons. It is really remarkable that Rwanda is taking the bull by the horn and showing the pathway for all countries in the region. It is my profound honor to address this esteemed gathering in the presence of Your Excellency, the First Lady. Your tireless dedication to health initiatives and women's empowerment has been pivotal in advancing our mission to eliminate cervical cancer in Rwanda. Your leadership and advocacy serve as a beacon of hope and inspiration for all. Let me also congratulate the Rwanda Biomedical Science Center, as well as the Ministry of Health for developing the Health Sector Strategic Plan, which is building on the success from the previous one that ended in June 2024, that has succeeded in reducing maternal mortality. 2, improving health workforce and infrastructure. We all know that the HSSP5 is building on this to strengthen access and universal health coverage, as well as to ensure that Rwanda achieves SDG. And we all know that if Rwanda is determined to achieve health-related SDG, it should be that is what is going to happen. So briefly, I will quickly talk about the progress in implementing WHO's global strategy for elimination of cervical cancer. But first, to highlight that we know that cervical cancer highlights social and economic disparities globally. The incidence of cervical cancer globally, although it is about 14.1 cases of cervical cancer diagnosed every year per 100,000 women, but we know that this is not evenly distributed across different regions. For example, countries in the African region has the highest burden of cervical cancer, where you have 31.9 on the average women diagnosed every year per 100,000 women for cervical cancer. This is superimposed on the existing burden of HIV, and we know that women with HIV are 6 times more prone to having cervical cancer. The mortality from cervical cancer follows the same trajectory and trend as the incidence for cervical cancer. Over the years, there has been a lot of progress in ensuring that cervical cancer is a preventable cancer. It's treatable. We know the pathophysiology. We know what causes cervical cancer. We know how to prevent it. We know how to detect early, and we know how to treat. So it is immoral that a woman or a girl should be denied access to these services based on where she is born and where she lives. It was on the basis of this that in 2018, the WHO Director General made a call for action to eliminate cervical cancer as a public health problem. And he was very passionate about it and established the Cervical Cancer Elimination Initiative, whose first task was to develop the global strategy. Now, the global strategy is premised on having an incidence of less than 4 per 100,000 women. That is the elimination threshold. Now, to reach this elimination threshold, there are 3 strategic actions that should be taken across the life course. 1, making sure that 90% of girls are vaccinated by age 15. Twice in a lifetime screening of women with high performance tests for 70% of women, and 90% of these women getting the appropriate treatment for cervical disease if they are found with cervical disease. If this is done and achieved by 2030 onwards, it will put every country globally on the track towards achieving the elimination targets. We know, like the previous slide I shared, that some countries, it's easier for them. The incidence is less, it's not as high. But for some countries, it's actually quite high. So they have a lot more to do with that. Since then, there has been several attempts at ensuring that all this strategy is put into action. First, in 2020, when the World Health Assembly resolution was passed, for implementation of the global strategy for cervical cancer elimination. And between then and now, WHO has been developing guidelines, tools to ensure implementation. And we have come a long way from the early 2014, 2015, where we were using big tanks of cryotherapy machines for treatment and VIA. Now we have more tools to fight cervical cancer. 2030 is just a few years down, so there is need to redouble our efforts. There's need to make sure that every country globally should be on the track for achieving elimination. Now, in terms of progress, every country was affected by the COVID-19 pandemic, and that slowed down a bit of progress. But for vaccination, on the average, we know that at least 27% of girls globally have received at least one dose of HPV vaccine. However, the 27% is still far from the 90%. Ensuring equitable access to HPV vaccine is essential in closing the gap and protecting more girls from cervical cancer. I know that Rwanda has consistently been able to achieve this 90% goal of HPV vaccine, and congratulations to Rwanda on that. However, we know that there are several countries that face challenges in terms of vaccine, and one of the issues has been in terms of cost, in terms of availability of vaccine, and the WHO has not rested, and we've actually last year 2 years ago there was a recommendation for single-dose vaccine, single-dose regimen for countries to solve the access issues and cost issues and the logistics issues. And I'm glad to inform you that several countries are adopting these single-dose vaccines to be able to reach more girls. The screening of 70% of women between 30 and 45 years with high-performance tests has been quite an issue, especially in low and middle-income countries. Most times, screening is either opportunistic and using visual methods, VIA, to screen. It's opportunistic, it's not population-based, so coverage is low. We are hovering between 20 to 30% for the best performing, for countries that are performing well. Access to high-performance tests has been an issue, a major issue, either because of the costs of HPV DNA tests or because of the logistics and the high turnaround time that we are still trying to navigate through. But there's also an innovation to it. Self-sample collection frees up the time of the healthcare worker to only perform an examination on those that are positive. So it's a triage. It frees up the healthcare worker time. It also makes more women accept to be screened because it's easier and there's a bit of privacy. And we are working to improve these approaches and make sure that it's more widely adopted and used. Treatment is for the 90%, the third 90% is one of the other barrier. We know that issues about the health systems, challenges with the health systems in terms of infrastructure, in terms of human resource, get a part to play in access to treatment. there's limited access to, for example, radiotherapy services. The last time it was there are about 28 countries in the region, in the African region, that do not have access to radiotherapy. Surgery, most countries do not have appropriate skills and technologies to be able to perform simple gynecologic and oncologic surgeries. So there's a lot of gap in healthcare workforce. But there are opportunities to improve access, because we know innovations have been able to make a change. Technologies are available, such as the thermal ablation machine, the equipment, rather than the huge tank that most people will go around with in those days. There are thermal ablation machines, and there are LEAP devices that offer low cost, and they are effective options for treatment. In terms of human resource and infrastructure, there's also opportunity for cross-border south-to-south collaboration, sharing best examples and experiences, and sharing resources across countries in the region. From WHO's perspective, 2030 is just 5 years down the line, and we have no reason not to be able to achieve the 90-70-90 target. So WHO stands ready to support member states in collaboration with partners, and we've partnered with several organizations and NGOs and civil society organizations. We've partnered with UNITAID to scale up secondary prevention in terms of providing access to thermal ablation devices and to scale up screening. We've partnered with other NGOs, including the Clinton Health Access Initiative. So we are ready to support government to develop tailored national strategies and policies and guidelines, selection and national adoptions of new products and services, to design systems that are fit for purpose and scalable service delivery across the life course. We know that example of the relationship between HIV and cervical cancer, integrating cervical cancer screening and treatment into HIV service delivery, and there are countries that are actually have been successful in being able to do that, and we are happy to support member states in doing that as well. Training of the healthcare workforce is also one of the key things that we need in the region. There are countries that have been able to, I know, to meet the shortfall in human resource. So task shifting, some countries have been able to use their nurses to be able to perform LEAP through training, and there has been some South-South collaborations in terms of ensuring that services are delivered. So I would like to conclude with these few words. One, elimination is within reach. Countries across the region, irrespective of their economic status, can achieve the 90-70-90 targets. The launch of the Rwanda Mission 2027 is an attestation to this. South-South collaboration and regional pathways advance action. Sharing best practices, there are countries that are good at training, at integrating HIV into their cervical cancer clinics and vice versa, and that have been able to deploy nurses to provide services such as LEAP. So South-Side collaboration is important. Political will and global advocacy are essential to accelerating services for cervical cancer elimination. This is important, and I want to actually acknowledge the role that Rwanda has played in global advocacy for cervical cancer. In 2020, Rwanda was one of the countries that actually co-sponsored the resolution for elimination of cervical cancer, WHA 73.2. This year, Rwanda is also one of the co-sponsors for the establishment of a World Cervical Cancer Elimination Day, which will be on November 17. We know that Rwanda has also been championing and been on the forefront of commemorating November 17th, and last November 17th was when Rwanda actually announced also that they were going to move the needle. They are not going to have the elimination target by 2030. They are going to reach the 1970-90 target by 2027. In addition, Her Excellency, the First Lady, has also been a global champion and a regional champion for cervical cancer elimination. During the World Health Assembly resolution that was passed, the First Lady actually participated in some of the live stream events, and she's also co-authored an op-ed on cervical cancer in collaboration with other leaders and the WHO Director General. Achieving the elimination requires sustainable and diversified financing models. It's important that every country looks at what financing model will work, looking at existing structures and services and where leveraging can happen. We know that structures and infrastructure are already there for maternal, reproductive, and sexual reproductive health. We know that there's been a lot of investments in molecular testing capacities, either from COVID-19 or from HIV program. There are also funding from these other programs that countries can leverage on. Last but not the least, cervical cancer elimination will advance universal health coverage. We know that eliminating cervical cancer means that women, girls get access to services that they deserve, that they need, when they need it, at no cost to them, and in a form that is socially acceptable to them. So it's no coincidence that Rwanda is also launching the Health Sector Strategic Plan 5, along with the Mission 2027, because the Health Sector Strategic Plan 5 is also looking at achieving the Universal Health Sustainable Development Goal, which universal health coverage is part of. So we have 20 distinguished colleagues, ladies and gentlemen. We are in 2025 now. 2030 is just around the corner. We need all hands on deck to be able to eliminate this preventable cancer. I leave you with the words of the Director General that WHO's global strategy to eliminate cervical cancer is one of the examples of the life-saving work that WHO does. I thank you for your attention.
Another round of applause to Dr. Prebo. Indeed, Rwanda is an attestation that elimination of cervical cancer is possible, and we will do it 3 years prior to the plan that WHO had set. Next on our agenda, we are going to have a panel discussion themed Mission 27 through the lens of the Health Sector Strategic Plan 5. Honorable Minister, allow me to invite our moderator, Dr. Parfait Muhoza, to lead us through a panel discussion on Mission 27 through the lens of the Health Sector Strategic Plan 5. She will invite the panelists who will discuss the key strategies, opportunities, and challenges as we work together towards a cervical cancer-free Rwanda. Dr. Parfait, the floor is yours.
Thank you. Honorable ministers, government officials, dear partners, distinguished ladies and gentlemen, all protocols observed, good afternoon and happy Heroes Day. My name is Muhuza Parfait. I'm a gynecologist and an SRH specialist and a researcher, and I'm honored to moderate the next panel. The theme of the next panel is role of multisectoral collaboration in driving the success of Mission 2027. We have 4 panelists, and the focus of this panel is to see the importance of multisectoral collaboration in achieving the elimination of cervical cancer in Rwanda targets. On our panel, we have Dr. Francois Uwinkindi, who is the manager of NCD's division in Rwanda Biomedical Center. Please welcome on the panel. Next, we have Ms. Lacey Hubbard, who is the president of Electa Foundation. Please welcome on the panel. And next, we have Ms. Nadine Karema, who is the executive director of Partners Health Rwanda. And the last panelist is Janet Gunnard, Director of Strategy, United. Good afternoon. Thank you for joining this panel. So before we start our discussions, please give a brief introduction in 1 minute, starting from Dr. Francois.
Thank you so much, Dr. Parfait. I'm Dr. Francois Uwinkindi. I work for Rwanda Biomedical Center as the manager of non-communicable disease program that also has a unit focusing on cancer diseases. So I've been working for Rwanda Biomedical Center for the last 12 years. So in NCD program now, this is my 4th year. Thank you.
I'm Lacey Hubbard, President and CEO of Electa Foundation. For those who are not familiar with Electa Foundation, we are a Swedish foundation dedicated to improving access to cancer care in underserved countries, because we believe where you live should not determine how long or how well you live.
Hello everyone, my name is Nadine Karema, Executive Director of Partners in Health. Partners in Health is an organization that commits to bringing modern healthcare to the communities closer and not leaving behind vulnerable communities. And we've been very involved in bringing state-of-the-art cancer care in rural communities. Thank you.
Hello, everyone. Honorable ministers, esteemed guests, all protocols observed. Thank you for the opportunity to take part in this today. My name is Janet Gunnard. I'm the Director of Strategy at United. For those of you unfamiliar with United, we're a multilateral funding agency based in Geneva with a portfolio of projects in infectious disease and women's health. We fund projects to speed access to life-saving tools and to demonstrate and prove models of care. We're the largest funder of cervical cancer screen and treat tools, and we've really, in low-resource settings, and we've really appreciated the leadership of Rwanda and the partnership with many organizations we'll hear from today. Thank you.
Thank you for the brief introduction. Dr. Francois, you've been involved in so many actions regarding HPV screening and now cervical cancer elimination. What are the actions and innovations under Mission 2027 that will help achieve the targets within just 3 years?
Yeah, thank you so much. And if you look at, what is included in the Mission 2027, actually this is a strategic document designed to accelerate the implementation of cervical cancer elimination, intervention, so that we can be able to achieve the targets that have been presented earlier on, by 2027. It has got our strategy has got 3 pillars, and around HPV vaccination, cervical cancer screening in eligible women, but also ensuring that women with invasive cervical cancer have access to timely and quality treatment services. So the first pillar on vaccination, actually we have already achieved the first objective. So our cervical cancer, our HPV vaccination has been really high since 2011 when it was introduced. So the strategy and the goal is to keep it high, because this is a strong pillar, but also a foundation to achieving cervical cancer elimination. The second one is on cervical cancer screening in eligible women. I think this is where we need to work hard, because we are still behind. As we speak now, the coverage in eligible women, we are around 30%, and yet the target is to reach 70%. So now that's really where we need to go first, even run, so that we can be able to achieve that one. But also, one of the innovations that we do have, now we are also prioritizing HPV DNA testing, as it has been presented. VI is no longer, part of our guidelines, but also the main focus will be at the primary health care level, but also at the community level, focusing on, self-sampling, but also involving community-based systems, and also using digital tools to invite women, to educate women, so that they can use our screening services, but also to track, how we are really implementing. And then why, screening, because we have to screen around more than 1 million women in 3 years. Definitely we will be identifying more women with invasive cervical cancer that need to be treated. The second pillar will be focusing to strengthening our diagnostic and treatment services, so that we can increase our treatment capacity through training additional human resource. We have already started, and I think our first cohort of gynecologists has recently graduated, and we are training others so that we can have a critical mass of well-trained, professionals to be able to treat our patients with invasive cervical cancer. But also we need to increase access to radiotherapy services, but also to chemotherapy services. We are happy that now, I think with the recent cabinet resolution, part of cancer care and treatment services have been included in the package in the benefit package. Services for community health insurance. This will increase, affordability, but also accessibility, so that you can be able to achieve 90% of treatment coverage. So all along that process, we will be, all those objectives can be achieved through strengthening our digital systems, tools, data systems, but also research, but also focusing on community engagement, but also bringing all partners on board, because this is, a fight that we needed all of us to participate in, because no one can achieve it. That's why every time we're saying that this really, strengthen our multisectoral collaboration, so that we can also be able to achieve our common goals of eliminating cervical cancer in our country.
Thank you. You've mentioned quality care, screening, community engagement, digital, screening, diagnosis, and insurance. This sounds like a lot of collaboration and partnership. So what is RBC's plan to ensure the progress of this partnership with the different partners?
Mm-hmm. Yeah, thank you again, because if you look at what is included in the Mission 2027, collaborations, partnerships, these are at the heart of Mission 2027. Because we very well know that to be able to eliminate cervical cancer, we need to use a whole of society approach, make sure that really everybody is on board, and we keep updating each other. So, and that really requires a strong coordination at all levels. So because we have only 3 years to be able to achieve the targets that you have mentioned, meaning that we need really, to have innovative ways to be able to achieve it, but also make sure that we are very coordinated. One of the main, interventions or the main innovations, we are establishing a cervical cancer elimination dedicated office at RBC, so that we can have really focused human resource people, focusing on daily basis coordination, but also make sure that the progress is being done, but also coordinating interventions for all partners. On top of that, we will have a task force, a cervical cancer elimination task force, composed of experts in the field advising, our team at RBC that will be doing on the daily basis activities. But again, in the spirit of bringing everybody on board, we also established a high-level committee on cervical cancer elimination, providing a strategic direction, but also, overseeing everything that is being done so that really cervical cancer cannot really be seen as intervention from the Ministry of Health, but also all sectors, being government institutions, being partners, being, civil society organizations, even the community, so that everybody can be able to play a strong role in this journey towards elimination of cervical cancer in our country.
Right, thank you. I like the part of task force for cervical cancer elimination. In a few words, how do you see HSSP 5 with the elimination of cervical cancer and also achieving the Mission 2027 targets to sustain the collaboration and the progress of this project?
Thank you again. So if you look at, actually, HSP 5 will serve as a foundation to the success for this elimination, to this cervical cancer elimination. If you look at the main pillars, the strategies, the priorities that we have in HSP 5, namely, strengthening the primary healthcare system, transforming and modernizing our healthcare system, integration of services, all of those are ingredients to the success of our cervical cancer elimination plan, because now the focus for our cervical cancer elimination strategy is to focus at primary healthcare level. So we need a strong healthcare system. We need, all those screenings, vaccination, interventions are done at primary healthcare level. So having a strong primary healthcare, system will also help us to be able to implement our cervical cancer elimination interventions, because we don't want to have a standalone cervical cancer program. It has to be, fully integrated into the existing healthcare system. So second, if you look at also other priorities that we have in HSP 5, modernizing the healthcare system or infrastructure. So we clearly know that, yes, we need really like screening and vaccinations. So those are things that can be done at primary healthcare level. But when it comes to treatment of invasive cervical cancer, when it's a specialized care, that's why, modernizing our healthcare facilities, training people, having, up-to-date equipment, that will also help us really to make sure that really the women that are being diagnosed can get really, an adequate treatment. Again, without forgetting the digital tools. Actually, we are implementing, we are focusing on a campaign mode, because we want to quickly bring those women that are not screened from the community to come and be screened. But we think that after 2027, we will try now to implement a population-based, cervical cancer screening program, so that and the digital tools will play a big role, in driving awareness in the community, in inviting women to come and be screened, but also in tracking, how we are achieving the progress. So we do think that really, but also integration, because now we think that after 2027, the focus will be on integration, into maternal child health programs or services, HIV services, so that really, we reduce those missed opportunities and then be able to provide those needed services to our women that are in need. Thank you.
Thank you so much for the explanation. You talked about HPV screening. Ms. Lacey has been in Rwanda for some time regarding HPV screening. Would you share your experience in the years you've been in Rwanda, and also the lessons learned with the HPV screening, and also part of eliminating cervical cancer in general?
Sure. We came to Rwanda about 3 years ago to join the mission to eliminate cervical cancer, because Rwanda has done a wonderful job. And our objective is really to develop a model, and that is scalable, sustainable, can be also adopted to the other countries, like the Great Lake regions. So together with the partners, we developed this model, faster model, making screening faster, better, and more cost efficient. FAST stands for fast HPV testing, affordable cost, systematic tracking, and a timely diagnosis and treatment. So the results has been remarkable. So I gave you some. In less than 2.5 years, 2.5 years, we have screened 160,000 women. and treated over 3,200 pre-cancer lesions. Reached 70% coverage in Gicumbi, Kayonji, and Lubao just this week, with, Lubao, near Beho, with Lubao just 3% away from the same milestone, and the Kayonza is about 10% from the 70%. And we didn't just stop there, and because with PIH, we also implemented this called 2-in-1 dual screen, because breast cancer is also a big issue here. And with that model, we also screened 160,000 women for breast cancer. Of course, cancer treatment is dear to our heart, and so we also, working with the partners, implemented this called community-based palliative care in Gicumbi, including giving 1 egg a day to cancer women to help them to have nutrition intake and also improve their social cohesion. So we are super, super proud of what we have achieved here in Rwanda. But really, none of them can be accomplished that much without our amazing partners. And so I'd like to share 3 key areas where partnerships have made a huge difference. First, it's a partnership with the Ministry of Health. From day one, we work hand in hand with RBC to co-design and co-lead the program. And after working together across 5 districts, we have built a trust and the momentum, and that's had led to ambitious initiative like Mission 2027. Second is partnerships with NGOs. We work with a lot of civil society NGOs in Rwanda. So let me give you a few examples. So in our program, SFH has played a vital role to community outreach. As we know, there's a lot of stigma, fears. Just because the service is free does not mean these women will come. So with SFH, they have a deep connection with a community, and they know how to mobilize women. So through community health workers, they have been able to bring 1,000 women a day, and that's not a small feat. And Chai has also helped us during our very early stage of work. We implemented our very first pilot project together in Gicumbi, and we have learned so much from them. And then comes to PIH. I still remember after we finished Gicumbi, and we were talking about doing the 2nd district. And Dr. Francois came to me, is like, hey, Lacey, can we do 2 districts? I said, well, I'd love to, but we don't have enough money. So he said, he told me about this breast cancer screening and that PIH gonna do. And so then I said, well, like we're targeting the same women. Why don't we do this together, right? And that's exactly what we did. So together we create a model. So when women come to do HPV testing, they're also gonna go into the CBE. And so this way, we can maximize our resources, and we expand the coverage, and we increase efficiency. And that's, that model now become a standard practice in Rwanda now. And then also, like I said earlier, recognizing the need for comprehensive care. And we also ask Arcuyang to help us develop this community-based palliative care. Because now these women in the Kigali get a treatment, then they go to village and people think that they are contagious or they think that they're gonna die. So there's a lot of issue. Of course, nutrition is another issue as well. So through this program, we implemented Gicumbi. It's very, very successful. They get egg nutrition, and more importantly, they have social cohesion improvement. So as you see, NGOs, civil societies, has been a key role in our success on the ground. And the last one, not least, is a partnership with global experts and private sectors. Being in Stockholm, we have worked closely with our neighbor, Karolinska Institute. And they are the world leader in HPV research. And their insights have shaped our approach. Of course, Professor Parhans here, I don't know where Dr. David is. Professor Parhans is WHO's expert, and Dr. David from ESHKA has so many expertise. And I would say, if I don't bother you weekly, I'm always text you weekly to ask questions. So their expertise has keep us aligned with the best practice. So from the private sectors, we have received incredible support from Swedish companies such as Genius. Their Genocular, the mobile colposcopy device, has dramatically improved accuracy to detect precancerous lesions. So in our program, we don't just do VIA, we call this magnified VIA, the assisted by Genocular. And also their open system HPV solutions allows us to have decentralized lab at the district level, which making the screening faster and more accessible. So in the short, really, like I said, we cannot achieve so much in this 2.5 years if we worked alone. So partnership is everything to us.
Wow, thank you. Yeah, partnership. After hearing what you have said and what you have been doing in Gicumbi, Ruavo, and Nyabihu, I would ask you a personal question. Like, how can I join you?
And Kayonza.
And Kayonza.
Yeah, sure.
I would literally ask you a personal question like, how can I join you? I believe there's so many organizations present who might be asking themselves the same question. So for organizations that would like to join your initiative on HPV screening and cervical cancer elimination, how can they join? And also, can you tell us like what's other special thing you're going to do? Because eliminating cervical cancer in 3 years, it's very ambitious. So what is Electa Foundation going to do to help Rwanda achieve this target?
Sure. Well, we're super excited by this Mission 2027. It feels like just a year ago, it was a dream, now today is a reality. I remember, so tomorrow we're gonna go walk, right? I remember a year ago, we were walking, and Dr. Saben and the DG and Francois, we're kind of talking about like how to eliminate cervical cancer, how to screening. And so I gave some data, and then Dr. Saben asked more questions. Anyway, we're walking and talking, of course, like they walk so fast, so I had to run. And so then I said, okay, if look at our data, I think we can do 2029. And then we're going over number again. And then Dr. Sabine looked at me and said, Lacey, we're going to do 2027. Now, I think I'm an ambitious person, but this ambition just above another level. So looking at my facial expression, and he said, you know what? That's how our Rwandan do things. We're aiming high, we prepare well, and we move. And look at today. We are moving, right? So being the initiator, and we are fully committed to make Mission 2027 successful. So we're continually working hand in hand with RBC, of course. We also like to commit 3 things. I'm gonna name it. First of all, we are committed to provide HPV testing for 700,000 women, because this is very important. And we also will continually provide the technical support and experts to ensure the program is consistent, stable, and high quality. And also, I mentioned earlier, treatment is in our DNA. How to take care of cancer patients is important. So we'll continually support the palliative care, egg nutrition, and also social cohesion, the mental health, because cancer care is not just medicine, it's beyond that. How to mobilize, what's the message to the partners? I was saying, like I said, we've been working with so many partners and everybody's so wonderful. But this Mission 2027 is beyond wonderful, right? Why you don't want to join us? So I would say, whether you are big or small, local or global, new or long-term advocates, join us, because doesn't matter what you want to do. You come talk to us, we will find a role for you. And why don't you want to do it? We're making history here, right?
Great. Thank you so much. I've liked the egg part, giving eggs to the patients.
Yeah, you can help us give eggs. They love it because
Yeah.
they're. Dr. Christian can talk more about this. We just launched in the Karonji this week.
Wow. And you've talked working with PIH. Ms. Nadine, I would like to ask you, how is PIH planning to ensure quality cancer care in alignment of the Mission 2027?
Thank you. It's hard to come after Dr. Francois and Leslie because they've outlined some of the work that we've been part of in terms of RBC setting the guidelines or the alignments that we need. Lacey talking about the screening work that we've been part of. But I will give some other examples because as partners in health and based on our mission, we are basically in alignment with Mission 2027 in terms of screening, diagnosis, ensuring the treatment of cervical cancer and the vaccination of HPV. So how we plan to do it is basically boost some of the existing work that we've been doing. For example, referring to the lessons that we learned from back in the HIV days is to boost up our advocacy for HPV vaccines for young girls and in the community, spreading the messages in terms of removing the stigma. And when it comes to the women who have not received the vaccine, engaging them more and more to be screened, to attend the screening campaigns, because so far the response rate can vary between 8% and 38% of women coming to screening campaigns. So we want to work more with the community leaders so that the message is amplified about coming for cancer screening and removing some of the stigma. One of our doctors was telling me how some women think that cervical cancer screening means you get your cervix removed, or the husbands sometimes are not happy for their women to go and get this unnecessary or what they think is unnecessary invasive examination. So it's more about amplifying the message, and we'll continue using our 5S approach to have dignified space, meaning being in alignment with HSSP 5 modern infrastructure. So that means expanding the Butero Hospital that we support, which is already done, to have more space for oncology care and more women-friendly space for the cancer care, and supporting as well some of the health centers so that the space is dignified for women to be willing to go for those exams. And then we'll ensure also in terms of systems that we have a good digital system that we've been part of that's hosted at the RBC in order to collect data on cancer screening, and based on the data, have enough evidence on what approaches should be applied for ensuring that we save women's lives. We have already worked on SMS-generated messages through the application, the Muzima application, to ensure that women are informed about their lab tests being ready. And the next level will be more interactivity, because as PIH, we also believe that we have to tackle the socioeconomic barriers, or any barriers at all, that prevent women to come for screening or testing. So Our next level should be interactivity in the system or in the SMSs, sending a message to a woman and asking her why she's not coming for screening or why she's not coming for follow-up care. And that will train the AI, right? The next step after that should be an AI bot, but you can't get to AI until you've trained it with data and you have enough data. The next S will be the staffing. We'll continue training the healthcare providers to have good bedside manners when they receive women who come for care, and training also the community health workers, because they're the first level of healthcare workers, to spread the message, encourage the women, so that we have the women or the families ensuring that their young girls get the vaccination, that the women who are beyond 35-year-old or 25-year-old, if they're HIV positive, get screened. And for those who have screened positive, encourage them to not give up on the treatment, because when caught early, cervical cancer is treatable and curable. And in terms of the last S, I would say it's social support. At Partners in Health, we believe in full-on care of the patient. I like the French expression of care and follow-up, which is prise en charge. And that's really what we believe in Partners in Health. So making sure that if a woman cannot navigate the referral pathways, there are existing navigators, patient navigators, who help them be the liaison between, let's say, the health center and the referral hospital, making sure that if the issue is nutrition, we provide clinical nutrition at the hospital and at the health centers. So, making sure that there is no barriers, really, that prevent women, especially from the rural communities, to come and get the care that they need. And lastly, which is an example from what Dr. François and Leslie shared about, it's building partnerships. I agree with Lacey, we can't do it all by ourselves, and we're strong believers of that. So it's beyond just having international partners. If we want to beat cervical or to eliminate cervical cancer in Rwanda, we need to make sure that we involve local partners as well, including the private sector, which tends to be excluded from these, and having any companies building their CSR, their social responsibility, just to make sure that everybody, every single one of us, is involved in the elimination of cancer care. Thank you.
Right. Thank you so much. From your contribution, I see that eliminating cervical cancer needs a multidisciplinary approach, and also a big emphasis on the sexual reproductive health and rights. Can you dive deeper in the cervical cancer treatment in your experience as PIH?
Sure. So what we do, and in terms of also the additional support that we have committed to, is having satellite clinics. There are satellite clinics to Butaro Hospital that already exist, that we have supported, and ensuring better diagnosis, meaning lab testing. So we have already committed to a pathology equipment for the Butare CHUB hospital, so that we have beyond the Butaro Hospital and of course the Rwanda Military Hospital, there is additional hospitals that provide the tests. And in terms of the treatment, we've been providing chemotherapy at the Butaro Hospital, and we're very happy that the Ministry of Health and RSSB have committed to have chemotherapy as part of the mutual scheme. So, but that doesn't mean that support from partners and founders should stop around chemotherapy provision. Now there's more effort that's needed on new molecules and advanced treatment, and continuing to explore what are different treatment modalities that should be used for different stages of cancer. Because before the screenings, the massive screening that RBC has been leading, most of the women that we saw came at stage 4, but now it's earlier stages, which is showing the results of the screening. But nevertheless, we need to make sure that we explore new advanced treatment for all women, whether they're from Kigali or from rural area, and that we continue providing holistic care, which include also mental health care, counseling women when they discover they have a diagnosis of cancer, counseling their families so that they are accompanying them through the journey and they don't give up. And in terms of HIV care, yesterday we talked a lot about integration. So Leslie also touched a bit on that. How do we make sure that HIV care, HIV clinic and cancer clinic speak together? How do we make sure that we leverage fundings that exist on HIV to tackle cervical cancer, or to, at least to screen cervical cancer because of the 6-time risks for HIV patients? And also, how do we find creative ways of ensuring that HIV patients are priority? And at Partners in Health, we've done that before in terms of advocating some more for HIV patients to be on the priority list for HPV vaccines. So it's more about really amplifying all of that and having all the partners on board to make sure that our dream becomes reality, not only on commitment, but also on action.
All right. Thank you so much. Ms. Janet, you've been helping HPV screening in so many different countries. Would you share the key lessons learned that Rwanda can take in order to meet the targets to eliminate the cervical cancer?
Yes, thank you for the question. It's humbling, and I think I'll pick up on a number of different things that other panelists have said that really resonate, and we'll try to complement. But Unitate's been supporting cervical cancer work in Rwanda and in 13 other countries to achieve WHO's elimination targets. In Rwanda, we've been working in very close partnership with the Ministry of Health, with WHO, with Clinton Health Access Initiative, RBC, other partners. And our focus has been on screen and treat, so screening and treatment of precancerous lesions as one piece of a more comprehensive and holistic whole. We have found successful models to be very context-specific, but there are some common through lines or threads that I can pull out. I think one, and this is a credit to Rwanda for having already scaled and integrated HPV testing, but that can be a real cornerstone of state-of-the-art comprehensive services. I think second, overcoming barriers on access and affordability. I think the breadth of the work that we have done has helped to establish the role of different tools in a screen and treat program, and establish markets, establish visibility that this is achievable and can be done at scale. And what that's allowed us to do is then negotiate price and volume commitments to bring down the price of some of these tools. And so the cost of thermal ablation, for example, at point of care, we've seen that come down 40% through some of our work. We've seen the cost of HPV testing come down 40% as well. So that really enables a more comprehensive approach. I would say I really liked the points that have come up already on decentralization, community-based approaches, And I say that recognizing also the partnership we've had with Partners in Health over the years and the importance that the organization has always given to the role of communities in leadership. I think it's really about that outreach, that integration. And Dr. Prebo made the point that screen and treat is primary health care, right? That is primary health care, and a comprehensive, a holistic approach is universal health care. And so this is a very tangible, very concrete way to demonstrate that, to prove it, and to work in partnership with communities and community outreach professionals, people who are able to help spread the word, raise awareness. I like the point on training healthcare workers, community healthcare workers. I would also make that kind of a mutual exchange. I think these are people who are best placed to hear what some concerns might be, why someone might not be able to follow up with an appointment or has concerns or hesitations about taking up services. So I really think that a lot of that work, communities and the tools, integration of services, the centrality of HPV testing, and then linkage to care, linkage to treatment, linkage to psychosocial support as well, is really a broad ambition, but Rwanda is showing that it's possible and possible at scale. So I think marrying that ambition with the diversity of perspectives from people who are working on this from different angles is really, really key. And then finally, I would say bringing all of this together into a costed, concrete, and tangible plan. I think that's one of the things I find so exciting about Mission 2027 is seeing that ambition married with the hands on deck who can do it, and seeing that clear, costed plan and a pathway to seeing that become a reality. So I'm humbled by the brainpower that's collected even in this room today, and really encourage us all to continue the exchange beyond this panel, but just to also hear from each other and learning opportunities that I know we try to carry through in our day-to-day work, but it's really something special to see this much attention focused on cervical cancer. Thank you.
Thank you for sharing the best practices. So going forward with that, how is your organization going to contribute to Rwanda's Mission 2027?
Yes, we are committed to continuing to work in partnership with Rwanda. We are looking at how we can best leverage the learnings from the programs that we have run to date in partnership with CHAI, with WHO, with Expertise France and a few other countries as well, and with many of you in this room. And we're looking at seeing where those can be proof of concept, inspiration, demonstrating real tangible gains and how these programs can be done at scale. But then also leveraging some of the technical assistance and capacity that has been built up through the programs that we've been able to support, and where that might apply to other contexts and other settings. We are continuing the work on cervical cancer and excited about the future and being able to make continued and future commitments in seeing the leadership that we've seen in this country translate to real gains in many, many other countries as well.
Thank you. Highlighting what the panelists mentioned, they kept mentioning equipment, HPV testing kits, treatment, chemotherapy, and we all know the availability of HPV screening kits. It's very low in low resource settings. And I've spotted Dr. Huang Ting Li and also Dr. Tao Fing, who are the representatives of Genius AB Plus and also Roche. So would you please tell us your contribution to Rwanda's Mission 2027, as it's a very noble fight in this coming 3 years?
Good afternoon, everyone. First, I'd like to say this has been a very enlightening experience. I'd like to say congratulations to Rwanda, the people of Rwanda, Honorable Minister of Health. This is something that has really been a very enlightening experience. The discourse has shown us the value of partnership. And to answer your question directly, Roche Diagnostics has laid a foundation over many, many decades where cutting-edge technology is concerned in medical healthcare. And we've always been able to leverage on that experience to benefit many areas beyond our primary focus. For example, here in Rwanda, we've been able to establish and work in partnership with RBC and several other centers with our platforms for HIV. But you'll agree with me that our problems go beyond HIV. But the lessons we've learned with the program, testing millions of samples on a daily basis with our platforms, and the experiences we've learned in partnership with RBC and various other partners can be leveraged for a very important topic like HPV DNA screening. And therefore, our contribution here goes into 4 key areas. Number 1, we're able to ensure that what has already been invested and is available. Today in Rwanda, you have the capacity with what you have been installed to test well over 1 million patients. You have that already. No additional investment required. How do we leverage that for HPV? We will help you with that. That is our commitment to you. Second, it has been said severally that one of the pillars of the HSSP is ensuring that the workforce is able, well-trained, and available. Capacity building. We have a well-established experience in this regard. We have a scientific campus in South Africa that has trained over 8,000 people. And even in the countries that we partner with, capacity building is very important to us. We're willing to partner with you in that regard. Thirdly, access. Access is a function of 2 things. It's availability, it's affordability. So our commitment to you is to leverage on our current Africa vision where we have established our center in East Africa. So Roche Diagnostics, by the way, is the first and the only diagnostics multinational that is established and present fully, 100% in Africa for Africans. And that gives us a very unique way and mindset. We're able to see our challenges, we're able to understand and resonate with what matters. And therefore, we'll bring this to bear in ensuring that you have what you need, when you need, how you need. And finally, we've been talking about digital since yesterday. And we've seen the beauty of what Rwanda has been able to achieve with your HIC. We have a full portfolio that encompasses digital solutions from start to finish. So the patient journey is something that we're able to follow you through, ensuring that the tests are done, the doctor gets the results, and we're able to then now collate this and get valuable digital insight. And no, before I forget, research and development. Remember, Roche is heavily focused on research and development. And research is impossible if you don't have data and if you don't partner with the various institutions to facilitate and ensure that we're doing the right trials, studies, and we're collecting this for the benefit of our people. You'll agree with me that many times we get information from other parts of the world and we're expected to then now just fall in line. No. Actually, we should generate that information, that data. We should design the implementation patterns that are relevant for our people. This is what is critical. And that is what we have been doing for the past few years. The strength that Roche has, it's a full solutions company, ranging from screening to diagnosis to treatment and treatment monitoring. And I think having a one-stop shop that is able to partner with you on your journey to 2027 is a very valuable thing indeed. And on that note, I want to say congratulations again and give you our commitment to partner with you on that journey. Thank you.
Thank you for your commitment and contributions.
Hello, everyone. Hi. I'm Dr. Hua Qing Li. I'm the CEO for a Swedish company called Genius Plus AB. It's my great honor to be here today. I maybe want to introduce you about my personal story for the last 2 years for me and Rwanda, and what we as a private company bring to Rwanda. So everybody maybe know Genius from not HPV testing, but from our Copscope called the Genocular. We've been doing manufacturing, producing the Genocular for almost 15 years. Since we come to Rwanda from the supporting from CHAI and also from the Spider Foundation, Stockholm University, we've been delivered the Genocular since 2020 to Rwanda. And then we're trying to do this, empowerment to the nurses and midwives to using these professional tools. But since 2022, I came with the Electric Foundation, with the Lacey together. It's my first time to just do a very real visit to what is the real screening site look like, and what is the gap existing in the screening site. So then I found, okay, only the colposcope is not enough. Only the telemedicine is not enough. We should do the colposcopy and VIA upon the rightful groups, which means they should be HPV positive groups. Then come to the question, what is the best HPV solution people need in Rwanda? Now we should see the gaps. I traveled for more than maybe 40 times in the last 2 years only to Rwanda. I want to see everything. As an innovation company from Sweden, I don't want to be just like a guessing, imagining everything will be like this, like that, from the lab. I want to be in the field. So that's why I stayed almost for 200 more days in Rwanda, stay with my trainees. I think we trained more than 300 nurses and midwives. And also stay in Gicumbi, Kayonza, go to Kalonji. Lacey also been traveling with me pretty much for the last 2 years. And also, I witnessed so many different things, changed my mind. Take one example. When we do the HPV sampling, how sure you are the women they can self-sample themselves? You do the training session, you thought everything is already in place, but then it's around 10-20% failure rate in the end. They also causing the waste for the results or for the reagents. So then we go back to think, okay, what can be the rules we can change? And for the self-sampling kits, then in the end, we deliver this color detection self-sampling kits. So once the color change, you can be sure that this one is much more good sampled. This is number one. Number two, when you see the system now so far in the market, either it's a fully automated closed system, or it is very manually operated manual systems. Can we do something as a modulable, semi-automatic, can be easily, just a causality sourced and the system just in the field? Then we go back to deliver this automation extraction system to be self-automatic and to the whole platform. Then come to a very interesting question. I think when I come to Gicumbi in the beginning with Lacey, I didn't see any fridge in the field. So then we had to go to find a fridge. It's taken such a long time, and it's not very easy to deliver into the 3-hour driving from the center. So then I go back to think, can we do something change for these requirements for the reagents in the Africa, in the Rwanda? Can we do some kits? They don't require the cold chain, even the fridge. Then we found these lyophilization methods. So afterwards, we can deliver the kits under room temperature and even use it in the lab without any fridge requirements. And also number 4, if you see in the COVID time, there's so much procurement in the COVID machines. And now they are dusting, and can we reuse those machines as a sustainability required? So we go to see, it's a PCR-based technology. There's so many PCR machines already existing. So can we use this one to be testing for the HPV? This is much more sustainability. And then we also validated, everything's working fine. So in the end, the capacity, if you see the capacity for every day we do the mobilization, it's almost 1,000. So how can you make sure your test platform can support for the 1,000 of people testing per day is also a challenge. Then we come to optimize all these operation rules in the lab. So one day, I think so far we can witness around 1,200 samples per day as a current capacity. And we are still working on another platform, can even increase, even triple the capacity from nowadays. And totally, in the end, we can also see the cost. The cost is much more reduced for many reasons. It's open system. It's very designed, dedicated for the African market. And we can also see our company, we are much more also focused on the training session. We try to train all the local lab technicians so they can learn, they can take over, they can train themselves. So I'm mainly much more like a focus on the training for the first year, and I'm so happy to see my trainees become the master trainers. They train one generation of the new trainees. So it's much more like a sustainable we are trying to witness, even in this 2027 mission. So come to the environment. We are from Sweden. We care for the protection for the environment. It's aligned with Rwanda. There's not so many plastic in Rwanda you can see. So we try to reduce all the tips, all the plastic bags you are using in the test. So when you see our platform, one sample, one woman only causing 2 tips. 2 tips is much more minor than the other platforms. We save the environment by using this technology. There's no use for that, even for the plastic bags in the system. Come to the traceability. We also bring the barcoding system to the screening session. So far, we delivered more than 300,000 barcodes to Rwanda for protect the patient information, also to automate the reporting system. So basically, I want to say we focus on innovation and implementation. So I hope our technology, or our team, as MIDAS for the last 2 years, can keep on consistently supporting Rwanda to fulfill this 2027 mission. Thank you so much.
Thank you for your commitment and contributions. For the sake of time, people can still engage in this interesting conversation and partnership. But before we wrap up, I would like to ask panelists in just 20 seconds, what key message would you want people in this room to take home? Starting from Dr. Francois and to Ms. Janet.
Thank you so much. 30 seconds. It's like, with the strong political support and the commitment to eliminate cervical cancer, but also strong partnerships that we have, but also with all the commitments that we have from partners. So achieving the targets is no longer a dream, it's a reality. Definitely we will achieve them, but achieving them is not an end itself. It's a stepping stone towards, achieving the elimination, achieving that incidence below 4 cases per 100,000 women, meaning that achieving them is one thing, but also sustaining them over time. That's really where we need to work hard, continuing engaging partners, but also keeping track on what we are doing until we reach the incidence less than 4 per 100 women. So meaning that together we can be able to eliminate cervical cancer in our country, but also on our continent. Thank you.
Thank you.
Me? Yes. Okay. Mission 2027 is not just an ordinary campaign. It is an extraordinary movement because it will not only transform Rwanda, but also inspire the world. So we are, like I said, we are making a history here because we know what the cause, we know we have the tools, and we know we can do it. So my final thing is come to join us because together we can move faster, we can reach further, and we can save more lives. Join us. Let's do it.
Thank you.
So the key take-home message, each one of us is key to Mission 27, but I'll finish with some homework for you. Tell each one of the women in your lives, you yourself included if you're a woman, that cervical cancer can be cured if the younger women of your lives are vaccinated, and if the ones who didn't get the vaccine can be screened. And for those who are sick already or tested positive, encourage them to continue the treatment so that they can be safe. And you'll save lives, and the Rwandan community will benefit from it. Thank you.
It's hard to follow. I think I would just like to recognize that possibility with ambition is a really powerful thing. And we have the possibility. We've proven that screen and treat works. We have the tools, we have the models of care, that can be integrated into more holistic approaches with primary and secondary prevention, linkage to care. Partnerships are going to be key. And Rwanda's success here is going to save thousands of lives, improve care, and touch millions of women's lives, and drive elimination on a more global scale. So again, I think just to echo the sentiment, this Mission 2027 is not just a national strategy for Rwanda, it's a global inspiration. And it's really a pleasure and honor to be part of that and to be committed as UNITAID to standing with Rwanda, not only in technical and financial support and partnership, but also in mobilizing the international community to recognize the pioneering spirit here and what change that can make to ensure that no woman dies from this preventable and treatable disease. Thank you.
Thank you, the panelists, and thank you, the audience. The take-home message will be Byose ni ubufatanye from Dr. Menlas. So collaboration is the key. Thank you so much for paying attention. Thank you.
Thank you to our panelists and to our moderator. From Task Force Partnerships, the 5S, and strong take-home messages, another round of applause to our panelists. We still had questions and comments to our panelists, but they are still available, and make sure that you meet each one of them at the end of this session to exchange a contact, and make sure that next week, first thing is to call them or to make that contact, because we all have to be part of this history-changing movement. Next, we are going to turn our attention to the screens for a brief video that showcases Rwanda's remarkable progress and commitment to eliminating the cervical cancer. It's a short video, a 5-minute video. I hope that you'll pay attention. And after that, we will invite Honorable Minister for his remarks for today.
Over the past decade, Rwanda's health sector has transformed significantly. From limited infrastructure and resources to groundbreaking achievements in healthcare delivery, we have come a long way. These achievements have been guided by key enablers, including strategic investments, innovative solutions, and the strong foundation laid by previous health sector strategic plan. Building on these successes, the 5th Health Sector Strategic Plan adopts a comprehensive approach to enhance the health sector by focusing on 5 strategic pillars: strengthening the health workforce, modernizing health infrastructure, enhancing primary health care quality, building health security and emergency management, and promoting research, innovation, and digitalization. Additionally, 2 enablers, health financing and leadership and governance, support these pillars. The 5th Health Sector Strategic Plan also takes into account the shifting trends in the burden of diseases. With non-communicable diseases or NCDs now taking the lead, this plan focuses on tackling these challenges head-on. As part of our commitment, we have set an ambitious goal to eliminate cervical cancer, an NCD we can overcome and the one cancer we can eliminate. Today, we launch our Mission 2027, a comprehensive approach to achieve the 90-70-90 targets for vaccination, screening, and treatment by 2027, 3 years ahead of the WHO global target. Our efforts over the past years have already brought us closer to ensuring that every woman and girl has access to essential services for prevention and treatment. As the first African country to introduce the HPV vaccine, we've proven that 90% vaccination coverage is achievable. Now, we are expanding access to screening services using innovative technologies like HPV testing. Together with partners, we are investing in training the next generation of healthcare professionals and infrastructure to deliver high-quality and timely care. On a global stage, we are demonstrating that cervical cancer elimination is possible when we lead with the right policies, investments, and partnerships. We are saving lives and inspiring hope.
Muri 2020 nubwo nagiraga period najyaga muri periods menstruation periods ariko ziri irregular ntabwo zazaga ku gihe nk'ukuntu bisanzwe biza noneho mba curious why don't I consult a gynecologist nkareba ikibazo aho cyaba kiri ntabwo reka ngende njye kureba uko bimeze ngeze kwa doctor arambwira ati results zaje atari ko unfortunately twabonye uburwayi cervical cancer ariko iby'amahirwe iri muri early stages urugendo rwanjye rwagenze baramvuye mu kwa gatandatu mu kwa karindwi ndivuza mu kwa munani nibwo sessions zose zarangiye mu kwa 12 nibwo nagombaga gusubira kwa muganga nsubira i Kanombe mu cancer center mbona Dr Pacific tubonanye nawe arambwira ati ugomba gukoresha MRI ukoresheje MRI babona ya tumor yari kuri cervix ntikiriho yarakize burundu nta kintu na kimwe cyakiriho.
By prioritizing prevention, strengthening our healthcare system, and fostering partnerships, Rwanda is on track to achieve this ambitious goal. Together, we can build a healthier future for all.
Ndashishikarira abakobwa wajya for screening muganga akakurebera kugira ngo wumve yuko cervical cancer ntayo ifite kandi cancer ni indwara mbi ariko iyo wivuje kare irakira.
Good morning, Aramtse. So on behalf of Her Excellency, the First Lady of Rwanda, who is the true champion of cervical cancer elimination, I want to thank you all for joining us today as we launch this important plan to eliminate the cervical cancer in Rwanda. It's a journey we started a few years ago, as you heard from different speakers. And today we are starting another speed towards achieving these goals, because we've seen that it's achievable, has been achieved in Gicumbi, has been achieved in Karongi, in Nyabihu, in Rubavu, and the other areas of the districts. What about the remaining districts? So that is our mission 27. And everything we've done under the championship of Her Excellency, the First Lady, has been successfully achieved. And I will give 2 examples. In 1999, at Kichukiro Health Center, Her Excellency, the First Lady launched the first PMTCT program. For those who are not familiar, this is prevention of HIV transmission from mothers to their children. It was the very early days of scale-up of HIV program, especially trying to prevent the transmission from parents to their children. At that time, the transmission of HIV from mothers to their children was 10%, even plus in some areas. So today, we looked at the numbers of transmission from mother to child. It has dropped to 0.8% from 10%. So that day, most of the people in the room were there in different capacity, and we thought it's not going to be possible for some extent, or we're going probably to get to 5% transmission. So, but believing that can go below 1%, it's something that is giving us even energy to think elimination of cervical cancer is possible. So it's not a dream, just from nowhere. It's from facts, from what has been done before. The second example I want to give is on hepatitis C. Hepatitis C was a deadly disease. This virus has been there for years. And in 2015, at the time of interferon, of all the side effects you all know, there was a big clinic of cervical cancer, and almost in big hospitals, where people were coming every Friday to get interferon injection, and they could go over the weekend without life until they wake up on Monday, because the side effects were very severe. So the clinic was set in a way that it is a weekend with no life for the patients until they recover so that they can go back to work on Monday. And the dropout was 60% for those who are receiving this treatment. These are testimonies of patients you probably know, we had. So that time, a program to eliminate hepatitis C was launched. Again, Her Excellency the First Lady accepted to be the champion leading this process with different actors, partners. And the transmission or the prevalence of hepatitis C that time was 4%. From statistics we had at RBC, we were doing a lot of studies that time, prevalence studies, 4%. So we screened over 7 million people in a period of about 3 years, treated with the new oral medications that were becoming more and more available, but difficult to for access. After 4 years, the prevalence of hepatitis C dropped from 4 now to 0.4%. Unbelievable. So the hepatitis clinic is no longer there as a special program if you look at the different hospitals. Now we are dealing with other things because health issues are not always over at the same time. So we deal with an issue that with the tools we have, but also with the commitment in place. So today we are tackling another challenge that we believe we're going to make it happen even faster. Cervical cancer. And it has been explained by experts who spoke previously how this is achievable and how this is really a big problem. It's among the top 2 cancers in Rwanda. If you look at the numbers, the cases, over 600 new cases every year, sometimes 800. Death, more than 600, actually 600 is the number. So you look at the report, 600 to 800 new cases, nearly 600 deaths every year in Rwanda due to cervical cancer. And what's remaining to be done is it's not as big as the other 2 issues I mentioned. We are aiming to screen 1.3 million women at age that seem to be at most at risk. And we expect to get a number over 6,700, if I recall the numbers, that we need to treat at different stages that will be found. As we speak, there are already cancers or pre-cancer lesions out there in the community. If we don't do fast, if we don't do it now, intensively, aggressively, intentionally, we are not going to make the problem easier. Actually, it will be more complicated because they will reach different stages, sometimes difficult to treat. But we can make it earlier, like the testimony we received in a video. Detecting cancer earlier is the best thing, the best news you can give to your client in the clinic or in the community. And how much is going to cost us to achieve this? $38 million only. Only $38 million. Less than $40 million. This money can be mobilized if we all bring our efforts together. We've seen it with our partners, and we really thank you all. Thank you for your efforts. What you've been doing with the means available, even if you can run a clinic of 10, screen 100, screen 1,000, you're already doing a great job. So now we are moving as a team, as one team and one steering committee. We'll be reporting to each other, holding each other accountable and coming back with numbers and see when are we going to reach this 1.3 million. Should we wait for 2030? That is the global target, to get it by 2030. I think it's too far. If we can do it by 2027, we have 3 full years. We are still in January 2025. We have a whole year to plan and to screen and to continue, because in Gichumbi, in Karongi, it has been done. So now we are moving in other districts. Already covered almost 3 or 4 districts, 5. So 25 remaining. So let's move into those districts, screen with the technology we have. We've had a new technology from Genius, from Roche, from other experts and partners. The uptake, the community is ready. They just need us. They are waiting for us to provide the necessary putting things together. So now we have a plan. We have a commitment. I understood from the speakers, from the panelists, and from our champion. We are going to make it like we did with the 2 examples I gave, and there are many other examples. So how are we going to do it? Let's accelerate. Let's start from tomorrow at the walk. We're going to have a car-free day, a special car-free day tomorrow, as Leslie mentioned. When you exercise, when you move, you even have better ideas, better health to think and implement. So from tomorrow, this is a week of World Cancer Day as well, and today is a Heroes Day. So there's a special momentum really to bring together our commitment and make our community safer, free from cervical cancer, because this is achievable. If you are committed to this, could you please just raise your hand that we are behind our champion to achieve it? Thank you. Thank you very much. So now I would like to take also this moment to launch the 5-year strategic plan for the health sector, which is going to include other pillars. In addition to cervical cancer, is going to be the highlight, but there are many other things that you've followed in the video. The MC said we don't print books. It's the era of digital technology. I was told there's a QR, you scan and then you get these documents. So our 5-year strategy, known as HSSP5, Health Sector Strategic Plan number 5. We've already had 4, 3. So the next 5 years document is here, is official, is available to our website. And we are going now to start also implement, supporting also our special plan towards elimination of cervical cancer in Rwanda, the Mission 2027. Thank you very much. Let's do it. Thank you.
Thank you, Honorable Minister, for your remarks. Thank you all for your attention and your presence here today. As Honorable Minister mentioned, there will be a cervical cancer elimination walk tomorrow, and kindly pick your t-shirts as you step out of the room, and there will be a cocktail in AD12. You are all invited to that cocktail. And before we leave this room, as we have started this journey to make history, let's take a picture all together here on the stage. The protocol team and the technical team will help us to put us all together so that we keep memory that today marked a big step in this journey. So thank you so much, and you're welcome to the AD12 for the cocktail. All of us will be part of this picture, so let's come to the front. If you know you raised your hand, of course. As we come on stage for the cancer elimination walk tomorrow, we will all meet at the roundabout in Kimihurura. Tell your friend that we are meeting tomorrow at the roundabout in Kimihurura.